Mr. President, I rise today to address an issue that we're confronting here in the Senate, and it's an issue that folks in Pennsylvania and across the country are dealing with every day, and that's the opioid crisis. A lot of ways to describe this crisis, and I'm pleased to be able to talk about this issue today with two of my colleagues who will be following me in succession after my remarks are concluded. I do want to thank, in a particular way, Senator Whitehouse, Senator Shaheen, and our leadership for bringing this issue to the forefront within our caucus and here in the Senate. And I know the effort to pass the Comprehensive Addiction and Recovery Act, known by the acronym CARA, C-A-R-A, is a bipartisan effort, and I certainly appreciate that. In the case of Senator Whitehouse, he brings a deep reservoir of experience as a federal prosecutor, United States attorney, as well as the Attorney General of Rhode Island. So he brings both a law enforcement set of experiences as well as his care and concern about those who have addiction issues. So we appreciate his leadership. Senator Brown, as well, has worked on this for many years here in the Senate and is a member of the House of Representatives. So this is an issue that confronts all of us in our states. And we have to, I think our efforts have to be commensurate with or match the severity of the problem. This week, the Senate missed an important opportunity to invest substantial resources into our nation's heroin crisis. The amendment offered by Senators Shaheen and Whitehouse would have added $600 million in emergency funding to aid public health professionals and to aid law enforcement, the two main segments of our society who deal with the challenge of addiction on a daily basis. That amendment was defeated. And I think that was the wrong conclusion for the Senate, and I think wrong for the country. While the Senate failed to act on this amendment, there's no reason why we shouldn't find other opportunities to invest in anti-heroin strategies, or expressed another way, strategies that will lessen or reduce the likelihood that more people will be addicted to some opioid, which often leads to other kinds of challenges with regard to heroin, and far too often leads not just to addiction and the darkness of addiction, but literally the darkness of death itself. So we have some work to do, and we know that we can pass the Comprehensive Addiction and Recovery Act, the CARA Act, as I mentioned before. That's good, but that is not nearly enough. We have to do more than simply pass good legislation that will authorize policy to better confront the challenge. That would not be enough, though. If we have this in place, new programs, new approaches, new strategies, that's a measure of progress, but we can't ask, pursuant to that, medical professionals to do more to treat addiction if they don't have the resources, or ask law enforcement to do more if they don't have the resources. Heroin overdose deaths have increased 244% from 2007 to 13. So roughly a 6-year time frame, heroin overdose deaths are up 244%. It's hard to even comprehend that kind of an increase of a death statistic, not just a number, but a number that indicates the increase in the number of deaths. That alone should motivate us to do everything possible, to do whatever it takes, whatever authority, whatever policy, whatever dollars we need to invest in this, we've got to do that. But there are lots of other numbers, and sometimes we can get lost in reciting the numbers. I'll mention a few here that are relevant to Pennsylvania before I conclude. In addition to just passing the bill, the so-called CARA bill, we ought to be focused on taking measurable steps to indeed solve the crisis. We don't want to just address this issue, confront the challenge. We want to solve the crisis. And it won't happen in 1 year. It won't happen because of one bill or one policy. But we've got to put every possible resource or tool on the table to actually solve the crisis. There are lots of ways to illustrate the degree of the problem. I'll talk about a couple of communities in Pennsylvania just by way of example. The Washington Post, a great newspaper here, went to Washington, Pennsylvania. We have a county and a city just below the city of Pittsburgh, just south of Pittsburgh. It's Washington County and the city of Washington. So the Post went there last summer, began to interview people at the local level. Here's, I think, maybe one of the more stunning statistics that they found in their reporting. In 70 minutes, there were 8 overdoses related to heroin. Now, in this case, not yet deaths, but overdoses. So a newspaper could track in an hour and 10 minutes 8 overdoses in one community in one state. Then they tracked it over a 2-day time frame. So in 48 hours, there were 25 overdoses in Washington County, Pennsylvania, and 3 deaths in a 48-hour period. I cite that not just for the compelling nature of those numbers, but because of where it happened. This is not happening in communities that we used to think of as having a major heroin or addiction, drug addiction problem. We tend to think of it, at least in my lifetime, as being an urban issue. Big cities have this problem, but small towns less so, and rural areas or suburban communities have it. Unfortunately, in this case, this is a horror, an evil that knows no geographic boundaries or class boundaries. It's happening in big cities. It's happening in very small towns in Pennsylvania. It's happening in suburban communities. It's happening in high-income communities, in low-income communities, in middle-income communities. It's happened to everyone. There's no escaping it. And if it's happening in places like Washington County, which is not the city of Washington is not a big city. It's a moderate-sized city. And in other parts of that county, it tends to be a more rural county, or at least small town to rural. So it's happening there in those kinds of numbers. In 70 minutes or 48 hours, overdoses and overdose deaths, that gives you an indication of the gravity of the problem. The Coroners Association in Pennsylvania, that have to track, of course, the number of deaths in their county, reported that over just a few years in Pennsylvania, the number of deaths from overdoses went from less than 50 to hundreds of deaths in just a couple of years. So the gravity of this problem is I think, self-evident. But it's not good enough to diagnose the problem and recite statistics. We've got, as I said before, solve the crisis. So there's no doubt that this is a huge issue for the country. By not passing the funding that we tried to pass, we're missing a chance to support, for example, the Substance Abuse Prevention and Treatment Block Grant, so-called SAB or SABG, the SA Block Grant. That's an existing program, an existing block grant program that works. The only good news here in this debate about what policy to put in place is local officials know what they're doing. So addiction and medical professionals know exactly what to do. They know exactly what works. They know exactly what they need. What they're asking for us for is a little bit of policy, or a significant amount of policy maybe, but they're also asking for resources, and we've got to give those resources to them. So I will conclude with the following. We know that good treatment works. All the professionals tell us it works. We know so much more today than we did 25 years ago about what works. We know that good treatment works. It takes a long time. There's no 90-day program here. It takes a lot longer than that. So we know that for sure. There's no dispute about that. we also know that good treatment costs money. You can't just have good intentions here. Life-saving overdose reversal drugs like naloxone cost money. The good news is we have a drug to reverse the adverse impact of an overdose, and yet a lot of communities cannot afford to get this very important drug called naloxone, so-called reversal drug, as some call it. Intercepting drugs before they reach our streets costs money. The worse this epidemic gets, the more these services are in demand. So Congress, the United States Senate, and the United States House of Representatives must provide additional funding to make sure local communities can meet the demand. And we know that investing in programs that treat addiction and save lives is an abiding obligation.
Time has expired.
Just have 30 seconds if I could ask consent.
Without objection.
Is an abiding obligation that we must fulfill. So we've got to tackle this problem. We can't do it without resources. And with that, I would yield the floor.